Okay, now on the home stretch, we've just got a very short time, but we're going to use it very effectively and efficiently to celebrate the physically challenged, because we're talking about the World Sight Day. This is an annual day of awareness held yearly on the second Thursday of October to focus global attention on blindness and vision impairment. So this year, it was on the 10th.
It will
be on the 10th. We're not there yet.
Yes.
We're not on the 10th yet. So let me quickly, we've been joined now by Dr. Nathalia Daniel, who's a member of the Planning Committee for World Sight Day 2013. Good morning and welcome to Sunrise. And then on the other side is Dr. Olufunke Ani and Dr. Shonuga. Adeze Shonuga.
Yes.
Great to have you here. Let me start with you very quickly because of the limited time that we have. This year, what's the celebration about?
The whole celebration is preventing blindness, and now World Health Organization decided that there should be health for all in eye, health eye awareness. And theme for this year, get your eye tested. To reach the underprivileged, to reach the poverty group, to reach children, to reach geographically challenged zone, to get everybody eye tested to prevent blindness. That's the most important things.
All right. So, Dr. Ani, when we say that we want to have health for all, especially in the area of visual impairment and blindness, what kind of numbers are we looking at? Because we've got to look at the investment that it requires.
Okay. In Nigeria, we have this national survey of blindness, which has already been done by the Federal Ministry of Health and international partners. And that has revealed that for every 100 Nigerians, 4 has visual impairment. And with all the best correction we can do, there's still 3 left that is actually blind. So if we...
3 out of
3 out of 100 of Nigerians above 40 years.
And what did you find is causing this blindness?
The major cause of this blindness is preventable. Number 1 is cataract. Then we have glaucoma. Then we have childhood blindness. Trachoma used to be topping the list, but a lot has been done in that area now, so it's going down on the list, but it's not yet over.
Okay.
Yeah.
So, Dr. Adeze Shonuga, what's the activity you've got lined up as part of celebration?
Okay, thank you. As you rightly said, next week, Thursday, is the World Sight Day that has been designated internationally, being the second Thursday of October. And we have a week of activities lined up, where on Mondays, individuals, public establishments, health institutions, where there are eye centers, we are going to, at the level of the centers, raise awareness to our patients, educate them, and also we're going to be wearing blindfolds at each of those centers, even in the private establishment. Then on Tuesday, that continues. In addition to that, we're going to have a program on air. And then on Wednesday, another program on air, also on the radio station at 8 a.m. In addition to that, we're also going to have more awareness being raised. On Thursday, we're going to go to 2 old people's homes. One is Regina Mundi around Mushi. The other one is old people's home around Yaba. We're going to attend to the old people there, take care of them, examine their eyes, give them some supplements that will help nourish their eyes as well. And then on Friday, there's going to be a presentation on a channel on DSTV, Aguro Ayo, also in the morning at 10 a.m. And then we'll round up on Saturday. Now for this, everybody's invited. We're going to have a sight walk, a walk for sight. We're going to start off from the stadium. We're going to walk all the way to Tejo Show, back to the stadium, wearing our T-shirts, holding our banners, raising awareness, because we want people to know that most of the causes of blindness are avoidable, over 80%.
Okay. Dr. Dania, are there any days that you people are going to do eye tests so that we can know the locations?
You know, what generally check-up like this happens throughout the year.
Okay.
This day is just to create awareness.
Okay.
But because we are in Lagos and population is so high, we want to reach more people than it used to be. We have glaucoma day coming in March. We have some other programs that we are doing, free operations, checking people's eye. This one is just to create awareness, that we shall reach each home. Please get your eye tested. You know, it has to start from primary school, from nursery school, from primary school, going to secondary school, going to university. Because 80%, as doctor said, is preventable blindness. Just simple glasses can make a person to see very well and have 100% vision. That's where we are going.
Okay.
If it starts early.
Yes.
Okay, abroad they don't have this problem like we are having here because lack of education, poverty that leads to disability, disabilities that leads to poverty, gender. We were just discussing with Dr. Obi previously, gender, because 2/3 of blind people or visually impaired are women. They don't have that chance to get their eye tested. Geographical locations where people cannot even get to get their eye tested and so on. If person is blind, is a big trouble for the whole family, extended family. That's how we look at it. That's why we wanted to start as early as possible.
Okay, when we're talking of this, the funding, where is it going to come from? Are we getting enough from government? I know we never get enough from government, but the private sector, how do we turn to the private sector and say help?
Okay, the Ophthalmological Society of Nigeria, that's our professional association. We have a few partners that have helped us a little, but what we're talking about is massive. So we really need to appeal to main corporate entities locally to also be aware. This advocacy is not just get your eyes tested, it's also please bring the money so that the geographically challenged and socially challenged in whatever way, we can go to that doorstep because you have empowered us. So we really need help in that area. All the money bags in Nigeria, I believe some of them are listening to us right now. We are Ophthalmological Society of Nigeria. We are ready. We are technocrats. We're ready to deliver the service, but we need the funds so much.
Okay, so Dr. Shoniga, if there is available fund, which areas do you think should get top priority? Because like Dr. Daniel said just now, start early. But in terms of capturing the most significant numbers, which areas will they be?
Interestingly, the study that Dr. Annie talked about that was done some years back in those over the age of 40 was able to highlight that geographical location, some geographical locations seem to have a higher prevalence of blindness, and was able to elicit areas like the southeastern parts of the country having higher prevalence than, for example, the south, especially the southwest. But having said that, it can be alarming to find that even right here in Lagos, even in the area where the prevalence is said to be the least, there are people who need help. So even as much as one is bearing the geographical distribution in mind, charity must begin at home, and then we'll be able to spread our tentacles countrywide in order to reduce blindness in general.
In your experience, why do people who come late, who have eye issues, what reason do they give for coming late? They didn't know where to go, they didn't have money.
That's what I said, poverty. Before you go to check your eyes, patient comes and said that I have to pay school fee of my child. I have some other thing to support my family. I said later. When they come, it's already late. We are not even talking about cataract. We are talking about glaucoma that at times is irreversible. That's why we are having a problem. That's why we have a special day for glaucoma during the year. Poverty and lack of education. We still have not enough programs. People don't buy enough newspapers. People don't listen to TV enough. We just discussed PHCN. We know how many people don't have chance to watch this program because probably there is no light at home, no generator. That's the problem. We still need to create more advocacy for people. Please come. Don't postpone till tomorrow. Do it today.
Okay. Can I just very quickly mention, for those who are watching now, this is an extremely important conversation we are having on celebrating the physically challenged. And for that reason, we have extended sunrise this morning until 10 minutes after 12. So for those who are waiting to watch our very, very popular program, Metrofile, please be informed it will start at about 12:15. So your question, Alera.
I can't even remember what I was saying to us.
About prevention.
Yes. No, I was asking, do people actually